Okay, so what we're and when I say LMHA, I'm referring to Louisville Metro Housing Authority. So LMHA is trying to create a tobacco cessation education in public housing by educating our resident councils. So the resident councils are committees of residents that assist and serve as a resource for us and the residents of the community. And so these resident councils, they're charged with the of promoting programs and activities that improve the educational, recreational, and social opportunities for residents in their respective communities. Um, they're also responsible for managing affairs and conducting the business of the organization, as well as consulting and keeping residents informed. So, this program, what we want to do is provide some sort of an education to these councils so they can become peer educators for our residents. And our CHC, our social services staff, the Quit Line, and the Lung Association is going to assist us in educating the councils. So there's a number of things that we're going to try to educate the councils on: the effects of smoking on health, the available resources for residents who are interested in quitting, how to be an effective peer counselor, and how to be a health navigator, having those skills. Um, and when we're talking about being a health navigator, so this could be kind of an alternate route for increasing awareness for cessation programs instead of just the standard enforcing of HUD rules. Um, so ideally, residents will, or resident council members will be what we're thinking of calling health navigators, who, with the assistance of our CHC, would hold informational meetings, tobacco cessation programs, um, primarily the Freedom from Smoking program for residents in their building. And they'll follow up with those interested residents and track their progress with their cessation attempts. So this is going to be kind of more of a diversion from the standard warning fee enforcement that hasn't really been too successful. Um, so currently, the initiative is really in the first phases. On the 7th of this month, the council reps met with us, the CHCs, the Quit Line, the Lung Association, and a behavioral health specialist to discuss how we can begin coordinating the buy-in from the resident councils. And they all seemed very enthusiastic about this. So the next step is going to be scheduling meetings with the CHCs and the resident council members so that the CHC can educate the councils on the available health and cessation resources out there. And again, empowering those council members that are that want to be on-site health navigators. We also started our smoking cessation classes from what I hear in one of our elderly developments. That started on March the 11th. And so according to the facilitator who held that class, we had about 3 attendees. As far as any sort of recent changes, again, we're in the initial stages of this, so there's not really anything that's recently changed. But as far as the data part of it goes, as of 2018, we have 9 warnings that's been issued. There's anecdotal information that smoking still occurs frequently within the buildings. So whatever's been going on as far as the fee and warning system just really hasn't worked. So the cessation education through peer efforts could be a more meaningful way to eliminate the smoking. So I was thinking data could include attendance records, uh, recorded by the CHC and by the resident health navigators. The St. Catherine's, which is the facility who held the smoking cessation class, let me know that they've already issued a number of fines already. So my next step would be to put in a data request to find out how many of those fines have been issued and just kind of get that into kind of a standard procedure. That is all the information that I have for my case presentation. So I think I'll go ahead and open it up to any questions or comments or the next step in this process.
That's great. Thanks, Heath. This is Laura. Real quick, before we open it up for other clarifying questions, is there something specific that you were hoping to get group feedback on today? Challenges that you're facing? Anything?
So one thing I was thinking about is thinking about the kind of data to collect for this, and then also information or things that we can do really to promote this within our facilities, if anybody has any ideas on that.
Great. Yeah, so it sounds like a couple questions, like any kind of data that may be helpful to kind of both tell the story of kind of where you're starting from, and then also tell the story of impact of this new programming, and then ideas around how to generate interest from the residents in both participating in the training part of things, as well as like the participants of the Navigator program, the people who are smoking who could benefit from the services.
Right.
Those are great questions for the group. I have two clarifying questions myself, so you all think of yours, and then I'll open it up to everyone. Do you have a sense of how many smokers are how many people are smoking who are living in your units? Do you have any sense? Or the percentage?
I really don't. Yeah.
Okay. I was just curious.
Yeah.
And then can you remind me, Heath, like how big your organization is, like how many units you have, or just the landscape? I don't remember personally, and maybe others don't either. Yeah, thanks.
So for our public housing residents, we provide housing for approximately 4,000 families. And for our Section 8, which is not covered under this, it's approximately 10,000 residents or 10,000 families.
Oh, okay, great. Thanks. That feels, well, for sure decent size, maybe, and kind of big to me. So yeah, thank you. Are there any other clarifying questions from the group or from our faculty? Any additional information you want to ask Heath before we sort of dive into some discussion? Just unmute and dive in if you have a question.
Heath, this is Bob Burns from the National Center for Health and Public Housing. I'm just curious as to whether or not HUD has asked for any baseline data. I know they had published a Federal Register notice prior to the shutdown where they were going to start collecting baseline data and try to measure the effectiveness of the Smoke-Free Public Housing Initiative on getting people to stop smoking and compliance issues and so on. I'm just wondering if anybody there has issued anything to you guys out in the field requesting that kind of information.
I haven't seen anything yet. That doesn't mean to say it's not out there, though.
Understood. And if you want, I have one more follow-up comment or point, if it's appropriate to go ahead, Laura.
Yeah, go for it, Bob.
Okay. In other initiatives kind of like yours, and it sounds like you're doing all the right things, some of the feedback from the resident councils is along the lines of, in fact, one woman in Baltimore said this, and I'll never forget, she said, "I'm really happy that you're worried about my lungs, but we're really worried about safety and drugs in the community." And I know that you can't do everything through this effort, but as you're working with folks and you're trying to coordinate with the health center and primary care, if you can kind of address that stuff, it will really reinforce resident council support for the effort around smoking cessation. And so what we kind of did is, in one case is we basically took an afternoon and dealt with everything else just to kind of get that addressed for them, and to kind of get that out of the way so that they could focus on the smoking cessation stuff. So it's just a thought, and it worked pretty well in that case.
Yeah, that's kind of my sense also, like you said, is that a lot of times when we talk about these sorts of cessation programs, a lot of the residents, or just any kind of program, a lot of residents will kind of default back to, well, that's great, but fix my heating, or I've got a leaky roof, I'd rather you do that, that kind of stuff, and make this a priority.
But you know what? If you stick with it, though, the residents count, as you know, the resident councils can be your best friend, because once they're on board with you, they will really make an effort with the community and bring people in and kind of support you, as long as you demonstrate to them that you're actually going to make something happen.
Well, that's good. That's good to hear. Yeah.
That's great. Thanks, any other ideas or input for Heath, either from our faculty or any other participants about, maybe from our faculty, any ideas around how to engage like larger groups of people around the benefits of cessation versus just patient to patient?
This is Frank. I've got a couple ideas here. So if excuse me, I'd like to go over those with you. Excuse me. I'm going to give you a kind of different perspective on this, or a different way to look at it in a couple different ways. So hopefully this will help. I want you to maybe think about this through the stages of change model, first of all. And that says that, most behavior change does not occur just randomly out of the blue at one time. It's a process that occurs over time. And that process has certain steps to it. This is all research done years ago by Prochaska and DiClemente. You can look it all up. It generally refers to individuals, but I think it might be helpful to kind of use that as a metaphor when you're looking at a building, or the groups that you're working with. So what I would suggest is that you divide this up, and if people are interested in quitting, you put them in one group. But it seems like most of the people that you're talking about right now aren't very interested in quitting. So I would consider them to be in the contemplation or pre-contemplation stage. So primarily what you want to do is provide them with information. And I noticed that you are in your workflow statement that you have the effects of smoking on health. So I would just do a session where that's all you're talking about. You're not talking about quitting. You're not encouraging them to necessarily quit. You're just going to give them this information. Hopefully then they will make the leap, but it takes the pressure off of them to think that they have to quit or that you're pushing them to quit. I gave Becky a link to the CDC site where they have lots of handouts dealing with specific effects of smoking on health that you can use. So either do that in a meeting format, or maybe just send out emails, or put these under doors, whatever process you use to get the information out, and just kind of leave it at that and build on that. You might not want to do all of it all at one time. So looking at the different effects of smoking on health. The second thing is that in many cases, people are not interested in quitting for themselves. They're just, that's just not their perspective, but they will quit if they know the smoking is harming somebody else. So the CDC has a lot of information on the effects of secondhand smoke on family members or people in the household. And it's important that your residents understand that if you're smoking in your unit, it is going into everybody else's units. That it might not appear to be happening, but air is air and it moves around. And if there's smoke in the air, it's going to get into other units. So you're not only affecting yourself, you're not only affecting the people in your particular unit, but you're affecting everybody in the entire building. So that might be another way to get through to some of these individuals, especially showing them what it's doing to children. So, and there are handouts available through that and through the something called the Campaign for Tobacco-Free Kids. So I gave Becky a link to give to you for that. But I'd also like to talk about another perspective you might use that I've seen effective, especially with minorities. And that is the fact that the tobacco companies, we know now, have deliberately targeted those communities with specific marketing to get them hooked. And that this has been going on for years. And what I have found with working with individuals is that when they learn that they are simply a body, and if you think about this, about 3,000 people die every day from smoking. So these companies need about 3,000 new people, new bodies, new users to take over those people who've passed away. That really gets individuals angry. So I go at it from the perspective that the tobacco companies are manipulating specific groups of people into smoking more, smoking specific kinds of cigarettes, and not thinking about quitting. If you look at the data that was gathered when the tobacco companies were sued, they actually called this the SCUM campaign, SCUM, subculture urban marketing. And that included most minorities, gay and lesbian community, homeless. So we know that they were deliberately targeted to start and maintain their tobacco use. And again, I gave you some links to get some materials on that. That might be a different way of approaching this, especially if you have a large minority community in your buildings, to let them know that they have been marked, in a sense, by the tobacco companies to smoke and to stay smoking. So those are the three things. I would look at the health issue specifically with just providing them information, looking at how it affects kids. And by the way, kids have been targeted too. That's another link I gave you to start smoking when they're young. Just as a quick example, we know that the manufacturers of Camel cigarettes paid convenience store owners to put the cigarette packs on the counters at the level where kids could steal them, and to not stop them when they stole them, because they knew that if they took them, started smoking when they're 10 or 11 or 12, they're going to get hooked. So that's just one example of what they did with kids. So hopefully those three will help you.
Thanks, Frank. Now I'm angry too, reminding myself of all the ways that the tobacco industry has really targeted populations already facing challenges to, contribute to their own interests. So that's a great point, and I hope that might be helpful in your setting, Heath. Anybody else have ideas? Oh, go ahead, Heath. Go ahead.
Oh, I did have a question. And when you were talking about the subculture urban demographic, were elderly and disabled included in that?
Mm-hmm.
Not that I know of specifically. What I know is that it was the African American community, the gay and lesbian community, and the homeless community. This was like in the 80s.
Okay. I asked that because
there is a lot of data available, and you can actually read the memos that they wrote about this.
Okay, I was asking that because our public housing facilities tend to have a lot of minorities, but then also elderly and disabled individuals. So there's that group of individuals in that kind of a housing. So I'm wondering if that could maybe impact the messages that we send.
Sure, but you have to think, the elderly aren't being targeted by advertising to start smoking. They're trying to get these people young. Generally speaking, very few people start smoking after the age of 21. It's mostly younger people. So they're going after that to get them started. And once you started, as you know, it's an addiction. So you're hooked.
Keith, this is Linda Bailey. I just wanted to add in that we have incredibly good success rates with elderly people quitting. Okay. And I think a lot of times people say, oh, he's old, he's been smoking for 50 years, just leave him alone. But we actually have great success, and there are a number of clinical trials that Medicare did on cessation that really showed elderly people are able to quit. They want to quit. Some of the motivation is the same. You and Frank both mentioned the importance of family and community and the effect that smoking can have on them. And I think especially nowadays when, you know, if there are grandparents and their children are having children, they don't want those babies around smoke. And so it becomes really important, I think, for elderly people to think about family and to feel as though they're doing something good for their family, both in not, you know, quitting so that they are not exposing them to that tobacco smoke anymore, but also being a model that even though grandpa or grandma is really old, look at what she did or look at what he did, they were able to quit. So I wanted to mention that. And also one other thing, we've been previewing some of CDC's new ads for Tips from Former Smokers campaign, which is going to start April 1st, and it's all about family. There are a number of, I think there are 5 new ads, and 4 of them have connection with family. So it's family members who've lost somebody, or a teenage boy whose mother was a smoker talking about what it meant to him, that his mother was smoking and he knew it was bad for her. So that whole theme of talking to people about family and the impact on family of their smoking may be something that you get reinforcement from as soon as the TIPS campaign starts airing April 1st.
Hey, this is Catherine. I just have a quick note I wanted to add before we get close to the end here. And it was just trying to tilt the enforcement issue when it comes to, you know, instead of just constantly saying you can't smoke when you find a smoker, is I think one of the tools that we found in the field is that quit now card kind of helps with the enforcement angle being a little bit more like, hey, you know, you see a smoker there, you hand them this quit now card, and it sort of in that process shows them, yes, you're not supposed to be smoking, but at the same time, you can get help if you'd like to quit. And that's been a really nice tool for people to use in the process of what you might call enforcement. It shows that you care. At the same time, it takes away from saying you just did a bad thing. And then the other thing is, I think, trying to think of incentives for people to quit. It may not be money, right? But it could be that you have some sort of connection with one of the farmers markets or something, and those who do show an effort get a box of fruit or vegetables or whatever that might be. And I think just trying to tilt it like that. And I really liked what Frank was saying. It's trying to flip it and make people realize that, you know, this can happen and we're here for you. And then the final thing to add is that if you do find out that somebody has quit, really try and think of using them as a champion, and whether it's bringing them into a class or at least finding out if they're interested in helping to promote this even more, but encouraging that person to be your spokesperson in some form or fashion.
Yeah, real quick, I just wanted to echo what Catherine said. It reminded me, I did training at a hospital a few years ago, and we actually trained all the guards out in the parking lots because they were going tobacco free and they didn't want people smoking in the parking lots. And what the guards did was, if they saw somebody smoking, they walked up to them and gave them one of those quit line cards and basically said, you know, we're interested in your health. We really want to help you. We have a smoke-free campus, and I'd like to give you this card so you know where you can get some help. And that seemed to be very successful because, again, it's not judgmental. It's not hollering at them. It's actually expressing the desire to help them.
Yeah, that's great. Those are all super helpful ideas. We're running short on time, but I want to just make sure we didn't miss anybody. Anybody else have any input or ideas, suggestions for fees?
Just
Amy, go ahead, Amy. Oh,
can you hear me?
we can.
Okay, just one quick comment. I mean, those were all great comments and make a lot of sense, and I think can be very useful. Also, just, you know, utilizing the residents, again, taking advantage of those that have those positive stories, any testimonials, how they can be involved, those resident council meetings, just really getting them on board if you're able to hold resident engagement sessions. And those can be places for, you know, providing that education, that awareness of, why you're doing this, why it's good for them to comply, all of the health benefits, cost-saving benefits of quitting. If you're able to provide maybe monthly newsletters, so it can be hard to promote that, keep that fresh, but newsletters that are going through those different types of topics, concerns, always highlighting the cessation services. So continuously making them aware, what is available. Like it was said, if they're not complying or they're getting those fines, to always provide some type of cessation resource or service to them, so that they know that, they're human. You understand that it's really, really difficult to quit, but we want to help them along and not just kind of penalize them for breaking those rules, but give them something to move forward in doing to help them quit. And then lastly, just being aware of insurance coverage or how they can get medications. Many people aren't aware that they can go to their provider and get medications covered for free if they get a prescription, that sort of thing. So to always let them know, again, what's available to them, what they can utilize, take advantage of to help them quit.
Great, thanks, Amy. This is great. We're running short on time, but if you have other ideas or input for Heath, definitely just send Becky a note and she'll incorporate it into the notes as part of the overall discussion today. And then I know that you all, Heath, your housing authority is working with Shawnee Christian there, so that's a great partner there too. So that's what we're all here together to bring the sectors together. So that's great. Thank you for being our first housing case presentation. That's historic. You might be the first housing case presentation in the history of ECHO since 2000. No, I think that's true. I actually think that's true. Yeah, because we are the first ECHO project to bring in housing people. And so 15 years of ECHO started in 2003. You are the shining star. So appreciate your discussion and the case and all the work that you're doing there. Well, feel free to bring back an update in a few months. Let us know how things are going, and you may, as you go through this first phase, you'll have new challenges, and that's what we're here for, to keep problem solving together.